Welcome to the deep dive. We sift through the noise, pull out the key insights from loads of sources, aiming to get you properly informed fast. Today we're tackling something really important, a deep dive into women's health, specifically looking at the vulva and vagina. Our mission, well, it's to separate myth from medicine, find the actual science, uncover some surprising facts, and really push back against the misinformation out there.
And there is just so much misinformation, unfortunately. It's incredibly pervasive. I mean, false medical claims aren't new, but navigating health info today is tougher than ever.
Yeah.
You've got social media, obviously, with, varying qualities. But also this headline-driven news cycle that always needs something new, even if the solid evidence just isn't there yet.
Right.
And specifically with women's bodies. Certain historical forces have, often steered us away from good science, leading to some really, really fantastical medical claims over the years.
Okay, let's start there then. Let's unpack some of that history because it's pretty amazing how some of these ideas got lodged in there. Like, get this. Way back in 1844, an anatomist, Georg Ludwig Kobelt, published these incredibly detailed descriptions of the clitoris. Apparently, they're like almost as good as what we know today, but his work just essentially ignored. How does that even happen?
Well, it seems to be a mix of things happening at once. It was right around the time these really rigid Victorian ideas about, the dangers of female sexuality were expanding.
Yeah.
And then not too long after, you had Sigmund Freud popularizing this completely frivolous belief that the clitoris only produced an immature orgasm. That really pushed it out of the picture.
Wow.
Yeah, so it created this kind of cultural environment where understanding the anatomy accurately just wasn't seen as important.
It's wild how culture shapes medicine like that. For ages, just talking about female sexuality, even with your doctor, was totally taboo. So much of women's health, especially anything related to sex, was just unimportant, irrelevant. You see it everywhere, right? Like that story about Helen Hewlett getting jailed in 1938 just for wearing trousers in court.
Yeah, it reflects that broader dismissal.
The whole understanding of women's bodies just didn't get the focus it needed.
And that lack of focus, that lack of understanding led to some truly absurd ideas becoming mainstream in medicine. Like physicians in the 20s and 30s, they were pushing this narrative that the vagina was just inherently full of dangerous bacteria.
That makes no sense, evolutionarily speaking.
Exactly. If that were true, how would women have even survived to reproduce? It's completely illogical.
Right.
But this idea of a dirty or problematic vagina, well, it kind of fit the societal goal of, frankly, female oppression at the time.
Yeah, the challenges were huge.
Immense. You had a medical field and a society dominated by men, often with little interest in women's actual experiences. A very penis-centric view of sex.
Yeah.
Freud's influence hanging over everything.
And practically speaking.
The clitoris is mostly internal, much harder to study than the penis. Early cadaver studies, they had limitations, not many bodies, often older women, where clitoral volume decreases after menopause and, preservation distorts tissues.
Okay.
Before things like MRI, understanding its living structure, almost impossible.
It's just amazing how these flawed ideas could stick around for so long. And it's not just recent history either, is it? Going back to ancient times, you find these completely wild notions, like the ancient Greeks believing the uterus could just wander around the abdomen, causing hysteria.
Sounds unbelievable now, right? And they even had a cure for it.
Oh, yeah.
They would use fragrant smells near the vagina to sort of lure it back down, or foul smells up near the head to drive it away if it wandered too high.
Ah, okay.
It just shows how medical understanding evolves, Some ancient remedies, like chewing willow bark for pain that led to aspirin, it had a basis, but most discarded for very good reason. Uteruses definitely don't go on trips.
Definitely not. Okay, speaking of things that stick around, let's bust a modern one. This whole drink 8 glasses of water a day thing, I still hear that all the time.
Ah, yes. That one came from a calculation back in the 50s, I think, about total daily water intake. But the crucial part everyone forgets.
What's that?
That calculation included water from food. And we get a lot of our hydration from food.
Right.
So honestly, for most healthy people, your body has these really sophisticated ways of telling you when you need water. Just drink when you're thirsty. It's usually that simple.
Okay, good to know. So, if the past was so messy, what's the actual story today? Let's talk anatomy and pleasure, starting with the clitoris. Maybe we need a better term, like you suggested.
Yeah.
The clitoral complex, because it's way more than just the tip.
Absolutely. That's a great way to think about it. Yeah. When we say clitoris, we're talking about this whole intricate, extensive structure. The glands, the bit you can see, that's like the tip of the iceberg. Super sensitive, highest nerve concentration, yes. but most of the erectile tissue.
Yeah.
The stuff that really engorges, that's deep inside the body, the crura.
Okay.
And then you have these crucial parts, the vestibular bulbs, kind of like internal cushions sitting right alongside the urethra and vagina. It's a whole network.
And the big insight here is what?
The big insight is that all parts of this complex are involved in sexual sensation, and all parts are erectile. They all engorge with blood.
Okay, so what does that mean practically?
It means, for example, that women born without a visible clitoral glands, or women who've had surgeries affecting it, or even survivors of FGM, they can often still achieve orgasm.
Because other parts are still functional.
Exactly. It opens up this whole idea of sexploration, discovering pleasure by stimulating different areas. For some women, the glands might not even be the main route to orgasm. And this understanding, it offers real hope for women with injuries to the glands, showing how resilient the body's capacity for sensation can be.
That is a profound shift. Okay, let's tackle other myths then. The G-spot and squirting. Big ones.
Right. So that sensitive area many women feel inside the vagina, it's actually part of that clitoral complex we just talked about. It's not some separate magical spot.
It's all connected.
All connected.
Yeah.
With squirting, lab studies have pretty consistently identified the fluid as urine.
Urine. Real?
Yeah. Turns out the bladder can fill surprisingly quickly during arousal, and sometimes during a really strong orgasm, it can empty. That's why it's often linked to intense pleasure. It's not some mystery fluid.
That actually makes a lot of sense. So
Yeah.
the clitoris is really the pleasure hub.
It's the pleasure aggregator and amplifier, exactly. So whether it's external touch on the vulva or vestibule or internal stimulation from a penis, fingers, tongue, toys, it's all ultimately stimulating the clitoris.
Even nipple stimulation.
Even nipple stimulation.
Yeah.
That triggers an overlapping area in the brain. So the bottom line here is pretty clear.
A penis alone isn't always the best tool for the job.
For most women, no. It's simply not the most reliable way to achieve orgasm on its own.
Which might explain.
Which might explain why so many women feel pressured to fake orgasms, especially with male partners. Maybe because the cultural story suggests it should happen easily with the penis via some, non-existent spot.
Let's talk about the hymen next. Another area with persistent myths. Like the idea it evolved to make first sex painful, maybe to bond a partner.
Yeah, those theories don't really hold water. First off, for most women, first intercourse isn't painful enough to actually deter them long term. I mean, if it was that bad, we wouldn't see so many teen pregnancies, right?
Right.
And evolutionarily, if the goal was disappointment to keep women with their first partner, why make the clitoris so functional right from puberty? It seems counterproductive.
So what is the hymen then?
It's basically just leftover tissue. Remnants of cells from when the vagina was forming in the fetus. It varies hugely. Can be a ring, a crescent, have holes. Sometimes it's barely there at all.
Okay.
Occasionally you get a larger bit left called a septum. It can be thin or thick. Very rarely does it actually block the vagina, but it's relevant if, say, a teen hasn't had a period by 16, or if someone has pain or blockage with insertion.
And the vagina itself, the lining.
Right, the specialized skin called mucosa. And it's arranged in these folds, like an accordion called rugae.
Rugae.
A good way to picture it. Think of putting a king-size fitted sheet on a queen-size bed. Those folds are the rugae. Some women might feel them as slight bumps or texture inside.
Got it. Okay, let's pivot to hygiene and health myths. There are so many about food affecting vaginal health directly. Eat pineapple for a sweeter taste. Cut out bread to stop yeast infections.
Oh boy, yeah. Look, the reality is much simpler and, frankly, more empowering. Your vagina just wants you to eat a healthy, balanced diet overall.
No magic foods.
No magic foods. No specific bad or good foods for the vagina itself. Maybe trans fats, but that's bad for overall health anyway.
Okay.
That whole anti-candida diet, not really backed by science for vaginal yeast. Cranberry juice for bladder infections, no solid evidence there either. Fiber. Yeah, getting about 25 grams a day is good for your gut, and a healthy gut does indirectly support vaginal health.
And fermented foods.
Well, they might help gut bacteria after antibiotics, but we have zero research on whether they directly impact vaginal health specifically.
So diet sorted. What about cleaning? This is a big one.
Huge. And the message needs to be absolutely clear. Your vagina is a self-cleaning oven, period.
Anyone suggesting you need vaginal cleaning or tightening products?
Is wrong, potentially harmfully wrong.
Why is that?
Because the vulva isn't sterile, and the vagina is meant to be full of bacteria, good bacteria, like lactobacilli. They keep things healthy and acidic.
So cleaning products.
They damage those good bacteria. They strip away protective mucus. This actually increases your risk of odor, bacterial vaginosis, BV, and STIs.
And things like steaming, ozone, tightening sticks.
Equally harmful, don't do it. And definitely don't stick wipes up there.
But you can see why people get confused. Stores sell all this feminine hygiene stuff.
Stores also sell cigarettes, right? It doesn't mean they're good for you. Studies show women often don't tell their doctors they douche or use these products. Maybe they're scared of getting lectured, or maybe they don't think it's harmful to them.
Or maybe pressure from partners.
That's possible too, direct or implied. Look, if you have vaginal odor about 2/3 of the time, there's a treatable medical cause, BV, trichomoniasis, maybe GSM.
And the other third.
The odor isn't medically abnormal. Sometimes incontinence can contribute, but here's the irony. Overcleaning, douching, using odor products. That can cause odor by messing up the natural balance.
Okay, so what about products you do use, like lubricants? It's about finding one that feels right, sure, but what ingredients should you avoid?
Good question. The WHO has guidelines for water-based lubes. pH should be around 3.5 to 4.5, like the vagina, and osmolality under 380 melos/mdg.
Things to avoid.
Definitely avoid chlorhexidine gluconate. It kills good bacteria. Polyquaternium might increase HIV replication risk. And those warming, cooling, or tingling lubes, often irritating due to things like propylene glycol, alcohol, menthol, and capsaicin.
And labels like natural or organic.
Marketing terms. Doesn't mean they're safer or preservative-free. Always check the ingredients.
Good advice. And even for washing underwear.
Simple is best. Use a free and clear detergent. Perfumes and fragrances are common irritants for the vulva.
Makes sense. Soap itself can be harsh too, right?
Yeah, soap strips away the skin's natural protective layer, that acid mantle. It raises the pH way up, which dries out the skin. Vulvar skin likes to be acidic, around pH 5.3 to 5.6.
Okay, let's talk pubic hair. Many people just remove it without thinking, but it actually has a purpose.
It absolutely does. It develops at puberty for a reason. It likely provides physical protection, traps tiny bits of dirt, helps maintain humidity.
And the oils.
Right glands secrete oils onto the hair shaft, contributing to that protective acid mantle on the skin. Removing it doesn't make you cleaner.
And there might be downsides.
There's emerging data suggesting hair removal might be linked to an increased risk of certain infections, like HPV and herpes.
So if you do choose to remove it, shaving tips.
Yeah, to minimize ingrown hairs. Don't pull the skin super taut. Change your razor blades often. Maybe consider an electric razor. Chemical creams. Risk of irritation, waxing or sugaring, risk of burns, need proper technique and hygiene.
Okay, moving into the medical realm now. Communicating with your doctor. We know our own bodies, but symptoms can be confusing, right? Like bladder pain, feeling like vaginal pain.
Exactly, because the nerves overlap. So when you see your provider, lead with how much it's bothering you, your bother factor, and be precise about symptoms when they started, how often. Don't necessarily lead with what you think it is.
And mention concerns early.
Yes. If you're worried about a specific diagnosis, mention it before the exam. It might change what tests they do.
And crucially, pain with sex is not normal.
Absolutely not. Tell your provider. If they dismiss it, find another provider. Seriously. Healthcare professionals should be asking about sexual health. It's part of good care. Allows for referrals if needed.
Okay. If someone has irritation or discharge, what tests are essential?
The basics, which are super important cheap, are a pH test and an amine test, the whiff test. That gives so much initial information. For pain with sex, muscle spasm is the most common culprit, and often an experienced provider can tell a lot from a very minimal, gentle exam. Painful exams are rarely necessary to start figuring things out.
Let's discuss menopause now. There's been a shift from calling it vaginal atrophy, which sounds pretty awful, to genitourinary syndrome of menopause, or GSM. Why the change?
The much better term because it's more accurate and inclusive. GSM affects about half of women. Vaginal dryness is common, yes, but it's more than that.
What else happens?
As estrogen drops, tissues can become fragile, skin thins, labia might shrink, the vestibule doesn't stretch as easily, even clitoral erectile tissue decreases. It's a whole system change.
And sex doesn't prevent this.
No, studies show sex doesn't prevent the underlying cellular changes. It's not tissue protective in that way. Though, in very rare cases of extreme inflammation leading to scarring, regular stretching, maybe with dilators or sex, could potentially prevent that fusion.
What about bioidentical hormones? We hear that term a lot.
It's mostly a marketing term. Hormones chemically identical to what your body makes are synthesized from cholesterol, whether in your ovary or a lab.
So compounded estrogen.
It can be a valid option if pharmaceutical grade is too expensive, yes. But you need informed consent because dosing might not be perfectly accurate compared to regulated products.
And safety, especially after breast cancer.
Reassuringly, those lower doses of vaginal estrogen, like in the ring or the 10 microgram tablets,
Yeah.
they aren't really absorbed into the bloodstream significantly. So for most women, even with a history of breast cancer, they're generally considered safe. Always discuss with your oncologist, of course.
Okay, pelvic floor health. Weakness can cause issues like incontinence, prolapse, weaker orgasms. Kegels can help.
But they're surprisingly tricky to do right. Over 30% of women struggle, often clenching their bum or abs instead.
Do those fancy devices or trainers help?
Honestly, no study shows they add benefit beyond doing the exercises correctly yourself once you learn how. And please, avoid things like jade eggs. No evidence, and you can't clean them properly. Huge infection risk.
And the flip side of weakness is spasm. Pelvic floor muscle spasm, PFMS.
Yes, super common cause of vaginal pain, pain with sex. Often feels like being too tight.
Linked to other things.
Often linked to chronic constipation or other pain syndromes like vulvodynia, but there are good treatments.
Like what?
Retraining the muscles, often using vaginal dilators. Specialized pelvic floor physical therapy is key. It might start externally, use biofeedback, then move to internal work.
And the mental side.
Crucial. Working with a psychologist or sex therapist can help address trauma, anxiety, relationship issues that often play a role or worsen the spasm. It's definitely a mind-body connection.
Right. Let's talk STIs. Anyone who's ever had sex is at risk, right?
Anyone. Risk is higher for younger women, multiple partners, inconsistent condom use. And having BV actually makes you more susceptible to STIs.
And many STIs have no symptoms.
Exactly. That's why screening is vital. Gonorrhea, chlamydia, often silent. HPV need to know about cancer-causing types, the link with smoking, and the vaccine is so important for everyone.
Herpes, trichomoniasis.
Herpes is very common.
Yeah.
Trichomoniasis, we see a weird spike in women over 40, maybe due to estrogen changes, and it's linked to HIV risk. Pubic lice, actually decreasing, maybe because of hair removal trends, and easily treated OTC.
Protection.
Condoms, clear winner for STI protection and maintaining healthy vaginal bacteria. Use them correctly, watch out for stealthing, that's condom removal without consent.
Female condoms.
Great option, offer more control, don't need a full erection, good for anal sex, sharing toys, and don't forget pre-EP, the daily pill for HIV prevention. Highly effective, but uptake among straight women is still too low.
Where can people get tested?
Lots of places. Your doctor, STI clinics, local health departments, even home testing kits now. If you test positive for something reportable, it gets confidentially reported for tracking and partner notification, but your privacy is protected.
Okay, antibiotics. We know they're overprescribed, like 47 million unnecessary scripts in the U.S., leading to yeast infections, resistance.
Diarrhea, yeah.
Yeah.
It underlines the need for antibiotic stewardship, basically, making sure they're really necessary. Colds are viral, antibiotics do nothing. Green mucus doesn't automatically mean bacteria.
Why do they cause yeast infections?
They kill off the good vaginal bacteria, allowing yeast, which is normally present in small amounts, to overgrow.
Are some antibiotics less likely to cause them?
Yes. Things like nitrofurantoin, fosfomycin, metronidazole, trimethoprim sulfamethoxazole generally have low or no risk. If you get recurrent yeast infections, definitely get a culture to confirm it's actually yeast and the right type.
What about probiotics for preventing recurrent BV, yeast, or bladder infections?
Sadly, there's just no solid proof they help for any of those. Plus, they're often expensive and might not even contain what the label says.
And boric acid, sometimes used for recurrent BV.
It's important to know how it works. It's not by making the vagina acidic. It's cytotoxic. It kills cells. So it should really only be a last resort when other medical options haven't worked.
Okay, last big area, cosmetic procedures.
Yeah.
Labiaplasty seems more common now.
It does. That's surgery to reduce or reshape the labia minora. But here's the thing. There's no single normal size. Widths vary hugely, from less than a centimeter to 5 centimeters. And most women seeking surgery, their labia are well within that typical range.
So when is it potentially indicated?
Generally, it's best reserved for women with labia wider than 5 centimeters, or maybe a big size difference between sides, if it genuinely bothers them aesthetically or causes physical symptoms.
Does it affect sex?
We actually don't know much about the long-term impact on sexual function. Interestingly, female surgeons are less likely to recommend the surgery than male surgeons.
And what about things like the G-shot, O-shot stem cells for rejuvenation?
Hard pass. Under no circumstances can I recommend those.
Why not?
Zero evidence they work or are safe. We have no idea what they do long-term to the clitoris or vaginal lining. There's even a theoretical risk of reactivating dormant HPV.
Lasers for GSM or incontinence?
Still understudied.
Yeah.
And there's definitely no data supporting using lasers to tighten the vagina. That's pure marketing hype.
Okay, wow. We have covered so much ground today, from debunking ancient myths to navigating modern medicine and marketing. This deep dive, really separating fact from fiction about the vulva and vagina, it feels incredibly empowering.
Absolutely. That's the whole point. Having accurate information is power. My mission really is to help dismantle the misinformation. The patriarchy, the snake oil salesmen, they've had a good run, negatively impacting women's health by withholding facts or spreading myths. I feel like I'm not going to stop swinging my bat until everyone has the tools to be an empowered patient, and those who try to keep women in the dark about their own bodies have finally shut up and taken a seat.
That is a fantastic and vital mission, and it leads perfectly into our final thought for you, the listener. When you're looking up health info online, always ask, does this website sell products related to the information they're giving me?
Crucial question.
Because if they do, that's a huge red flag for bias. They might not be giving you the full, unbiased picture. Instead, make an effort to seek out trusted, non-commercial sources like the National Library of Medicine. They even have a great free tutorial called Evaluating Internet Health Information. It's a really good way to learn how to be your own best researcher.